Hey listeners, it's Paul Andriola here. Why not join our community at Small Cap Discoveries, where we offer our members direct access to some of the best microcap investment opportunities available. Our members are getting access to premium microcap financings, research reports, and direct access to management. Sign up today at www.smallcapdiscoveries.com.
Hi, everyone. Welcome to the Small Cap Discoveries conference call. Today on our call, we have back the CEO, Paul Baehr from IBEX Technologies. IBEX trades on the TSX Venture Exchange under the symbol IBEX and on the OTC under IBEXNF. The company currently trades at 51 cents with roughly 25 million shares outstanding, or about a $12.5 million market cap. I'd now like to hand it over to Paul Andriola.
Hey, thanks, Trevor. Yes, great to have Paul back with us. IBEX is a company we've been speaking quite a bit about amongst ourselves and then in the Small Cap Discoveries network. You guys have put together pretty impressive last year of financials. We can get into that shortly, but Paul, before we get into that, maybe just remind everybody what IBEX Technology is all about.
Sure thing. Thanks, Paul. I know a lot of people are probably already familiar with the company, but I'll whip through some of the background. We're small. We have a staff of 24 employees. Almost all of them are technical people in production, quality control, quality assurance. Our facilities are in Montreal. We're an international company. 95% of our sales are to international customers, and the other 4% are to Canadian subsidiaries of international companies. We do have a small percent of IBEX products which are sold online to the research institutions. Financially, we're debt-free. We have $7.6 million in cash. We had 2022 sales of $7.9 million and EBITDA of $2.7 million. Now, when I talk about finances, I usually talk about EBITDA more than net profit, because the moving parts in net profit for a small company like ourselves it's difficult to follow. The company was founded in 1986, and along the line we have launched quite a number of products. Some of you remember that in 2013 we acquired Baehr Research Products and then moved that business to Montreal in 2019. I only mention that because when you look at the 2019 financials, you'll see they weren't as good, and that was the reason for that was the transition costs. We have a very senior and focused board of directors. You can find out more about them online if you're interested. Our senior management is comprised of 3 people, all of whom wear many hats. Again, you can find out more about that online. Our business focus is developing and making proprietary enzymes for clinical diagnostics. We also do contract manufacturing of enzymes for third parties. That's where we don't own the technology, but produce for them. We specialize in protein lyophilization and the microfilling of disposable components. We also have a small line of proprietary collagen measuring ELISAs, which are used in osteoarthritis and bone research. This is a non-strategic asset that we acquired some years ago, but it makes money, so we keep it. The focus of our business, or the center of our business, of course, is our quality management system. In order to play in this game, you have to be ISO 13485. We're audited annually by the ISO folks, and almost annually by, every 2 years, by most of our major customers, and we've never had a major finding yet on that. Our key products, there are 6. There are 3 heparinases. The most important one is heparinase 1. It's used in clinical diagnostics for monitoring hemostasis, also in QC for low molecular weight heparin production and glycobiology research. Heparinase 2 and heparinase 3 are companion products, which are also used in QC and glycobiology research. And 2 products which we manufacture for third-party, synthesized beta lyase and beta synthase, which are used in homocysteine tests, and a product called aryl acyl amidase, which is used for suspected acetaminophen poisoning. So as I mentioned, most of our revenues comes from heparinase 1, which is used with devices that monitor bleeding and clotting potential of patients on heparin therapy. There are multiple tests. I just name a few here. The activated partial thromboplastin time, the prothrombin test time, activated clotting time, and viscoelastic tests. In other words, also called TEGs. And by far the most common of these is the TEG and the PT-INR. So in order to understand our business, one needs to understand the relationship between heparin and heparinase 1, our lead product. Heparin is used widely to prevent blood clotting, but excess of heparin causes bleeding, and insufficient heparin leads to clotting. So it must be very carefully monitored. So how do they test a patient's hemostasis status? Usually a sample of a patient's blood is taken and is broken into two parts, two aliquots. Into one heparinase is added into one of the aliquots. So you have an aliquot which has blood with heparin in it and one that does not have heparin, because heparinase 1 neutralizes the effect of heparin. And the delta between the two provides the clinician with the degree to which heparin is impacting hemostasis. So for example, most of us sitting here today will have an activated clotting time about 128 seconds. If it's elevated, basically you're not going to clot very quickly. And if it's lower, you may clot too much and cause problems, as we've seen in COVID. So turning to COVID, one of the reasons for our dramatic sales increase in fiscal 2022 has been the COVID-19 pandemic. Why? Because COVID-19 increases the risk of fatal blood clotting. And heparin is now routinely used in patients hospitalized with COVID-19. So this led in turn to a sharp increase in hemostasis testing and the use of the disposable tests which incorporate heparinase 1. Importantly, the COVID crisis has also led to hospitals to purchase more hemostasis testing devices. You know, hospitals are notoriously cheap when it comes to investing in new technology in a number of areas, but here they were forced to buy hemostasis testing devices, the high-speed ones, and now that they have them, we expect they're going to use them a lot more than they did in the past. So here, just an example of the major devices that we have helped people develop and introduce. This is the first one here on the upper left. There was the first product we introduced in 1993, followed by one almost annually thereafter. All of these are made by major international diagnostic companies. Heparinases are also used in discovery research. It's a very small part of our business, but it's very important because it keeps us in the eyes of scientists that are developing products in this area. And heparinases are also used in the production of heparin, first used in quality assurance, and our heparinases 1, 2, and 3 are used as quality control reagents by many of the leading heparin manufacturers. And heparinase 1 uniquely is used in the production of the low molecular weight tinzaparin. It's the only low molecular weight heparin that is made by heparinase digestion. And interestingly enough, it has got a new lease on life. It's a very old drug, but it's got a new lease in life due to COVID. So the making of tinzaparin is about a $1 million market. However, the good news is it's a big market. The bad news is we haven't cracked it yet. The one company that makes tinzaparin makes their own product internally. They keep coming to us to talk about us making the product for them, to which we readily agree, and we sit down, we chat about it, and then nothing happens for a couple of years. So they're back talking to us now, but whether they go forward with this or whether they put it on a shelf for another couple of years, I can't even speculate. Our second largest product is a product called aryl acyl amidase. This is a product we developed the manufacturing process for. It's sold to a major diagnostic company for testing of liver transplantation, and also for emergency visits for overdosing on Tylenol, which has been increasing over the last few years, sadly, for the healthcare community. I mentioned these two products which we manufacture for another diagnostic company. They are companion products, cystathionine beta lyase and beta synthase, which go into a homocysteine test. We don't own the technology for this, but we do it under contract, and it's a decent sized product for us. And then I mentioned we have this group of arthritis research ELISAs. They're really important for the study of osteoarthritis. The bad news is that there is not a lot of work being done in osteoarthritis these days, because nobody has actually found a drug that's likely to modify the disease. There's a lot of pain modifying drugs out there, but that's not the business that we're interested in, but it makes money for us. So in development, we are working on a oral preparation of diamine oxidase for histamine intolerance. It will be marketed, if it gets to the market, under the name Diamase. We've been making this product for a number of years as a research reagent. It has the effect of neutralizing excessive amounts of histamine, and about 2% of the population suffers from histamine intolerances, with diarrhea, headache, etc., etc., etc. And oral diamine oxidase breaks down histamine in the body. So we've been making this, as I mentioned, for many years as a research reagent, and several years ago we decided to develop the product for human use. So we're currently adapting the process that we acquired when we bought the bioresearch product several years ago. This involves the powder making, formulation, capsulation, bottling, and labeling. And we need to do this in a food grade facility. We're not food grade, we're lab grade. And so we are now in the process of scaling up the production methodology, and we will produce product for toxicology in a contract manufacturing organization. And at the point of getting tox ready material, which should be a year from now, maybe half a year, we'll make a decision about whether we want to proceed with the next step of the program, which will involve toxicology, where the expenses start to ramp up pretty significantly. So we will make a decision at that point in time about whether we want to make the investment ourselves in the tox program and go on to registration, or whether or not we out-license the product. So what is the market? I've mentioned that it's about 2% of the population suffer from histamine intolerance. Current sales in the market, Europe and the US, are between 15 and 20 million. We think the market is limited by the fact that they're mainly porcine-based products, which are offensive to many potential users. However, given the small side of the market and the fact that the investments are not insignificant here, we've been following a low-cost, low-risk development strategy using government grants and government facilities for development assistance. So the good news is this is a cost-saving strategy. The bad news is it's slow because they don't work at the same pace that we do. Nonetheless, it is moving forward. So now moving on to more recent stuff, the summary of our fiscal 2022 financials. Our year ended on July 31st. What we see here is just an overview that we see consistent sales and EBITDA growth and cash growth over the last 5 years, with the exception of 2019, where two things happened to us. One of our customers found themselves with about a year's inventory and stopped buying. And that's also the year that we spent a lot of money moving the plant from Iowa to Montreal. So looking at some more of the details here, you can see that revenues were up about $2.5 million. last year. Operating expenses up over $1 million, and I'll explain a bit about that in a minute. Net earnings before tax 1.4, net earnings after tax up by 900,000, EBITDA up by 1.4, cash and cash equivalents up by 3.2 million, and net working capital up by 2.5 million. So looking at expenses, what accounts for that large jump in expenses? Well, the first is profit sharing. We don't have a bonus scheme. We gave that up many years ago, and we have a profit sharing scheme. So we eat what we kill. We don't make any money. There's no profit sharing for the employees. It's really had an incredibly good effect in focusing the mind on what's important in the company. But this year, it was a huge payout, as you can see, and was I would say at the beginning of the year a bit of a surprise to us that we'd have the profitability we did. Other negative variance was in the other gains area. That is all to do with the government granting program that had to do with COVID. Last year we got 283,000 from the government. That last sorry, 2021 and 2022 it was like about 90, so that was about $193,000 decrease in offset of costs. Two other items: changes in inventory and work in progress, $177,000. That's a non-cash item. It's just a bookkeeping entry as we shuffle stuff from raw materials onto the balance sheet as work in progress or finished goods. Share-based compensation, there were options issued to employees and to the board. That's another non-cash item. Sales administration and other expenses, our cost of materials for the production of goods is buried in this particular line item, and so that 103,000 had all to do with that. And then the rest was professional fees and other stuff. Salaries did not increase very much last year, up only by $59,000. Board compensation went up quite a bit percentage-wise. That's because we added another board member. So if you look at the top 10 negative variances, $1.36 million out of total expenses of 1.4. So 96% of the negative variances were accounted by those top 10 items. So what were the 2022 drivers? There are four. I mentioned the increased use of heparinase-based diagnostics. There was also inventory build by our customers out of fear of supply chain interruptions. One of our customers had us ship them their entire 18 months forward supply, as an example. There was also some organic growth in the non-heparinase enzymes, which is good news for the future next year. And of course, the strong US dollar helped us a lot. So bottom line is, will this repeat in fiscal 2023? Answer, unlikely. We expect to do well in fiscal 2023, but we don't expect to see the same year that we had in fiscal 2022. We expect to slow down in heparin use. We've all seen the declining rates of hospitalization, and we also expect that customers are going to burn off some of their excess inventory. So I don't know what the sales are going to be like with any given certainty in fiscal 2023. I mean, I think they're going to be north of 2020, but they're certainly not going to be at the level of 2022. So that is my brief presentation. I'm happy to take any questions.
Perfect. Thank you so much, Paul. You mentioned the Diamase as one of the new products. I mean, are there other things that you're working on that that you think could eventually have a material impact on your business?
The answer is yes. We always have a portfolio of 3 or 4 projects that we're working on with customers, which we hope will translate into something real at some point in time. So we are the support in this process. So we have a passive role to play, an important one. We make money on services we provide, but we're going to make more money if they actually bring the product to market.
Mhm.
So we've got a couple of large projects there, and we've got a small number of rats and cats and things like that, which are not going to really turn the wheel, but will add something when they come to market. Not all these things come to market. People come to us with some very fanciful ideas of a product they want to develop, and we help them. Even though we think maybe what they're doing is going to be uncompetitive at the end of the day. So that's the pipeline. And I can't really talk much about it because they're,
no, it's
other people's
understandable.
products.
Sure. Yeah, for sure. But are you saying that there's some form of milestone payments or even back end, whether it's royalties or something? Do you share in any success? No.
No.
Okay.
The way we share in the success is by selling them the enzyme that we make.
Right. So if they're successful, they'll come back to you to purchase more enzymes as we go.
So if it's a serious program, they're paying us on a time basis, time and materials basis, and then if the product comes to market, we will, we'll benefit that way.
Paul, lots to talk about inflation, lots to talk about sort of supply chain issues, things like that. Are you still seeing those sort of things in place right now? And if not just those, what other challenges is the business facing?
Well, inflation hasn't hit us. We keep a very large inventory of raw materials. Large in the sense of the amount we need to produce our goods, our saleable material. Our cost of materials on our product line is about 3%. All the rest is fixed labor and overhead and stuff like that. And as a matter of supply chain management, because most of these enzymes can be stored for 2 years to up to 20 years at minus 80, we really, we keep an inventory, let's put it that way. And so we haven't had to buy anything over the last year. Now, if we're buying equipment for new projects, that is going to hit us. Or it's going to hit our customers, because any new equipment that's bought for a project flows through to the customer. They pay for it.
Okay.
So it's not a thing. And my worry has been about employment wage increases, and we had a 4% cost of living increase for our employees in November the 1st. Everybody seemed happy with that, and we haven't had any pressure to increase further.
Gotcha. So, the company is sitting on a significant bit of cash for the company this size. What do you see as the potential use of that capital? Part of it is, you've got a share buyback in place, but that can only, go so far. What else do you foresee is the use of the cash?
Well, the reason we have a large inventory of cash is because we have to do something significant to grow. We can chip away by growing, increasing organically and introducing a few small enzymes here and there. But really, what we'd like to do is to acquire something that's going to spread the cost of our fixed costs. To be in this business, to be ISO 13485, you've got to have a certain level of staffing and a certain set of procedures, and that all costs money. So we've got expansion capacity, and we can produce another 30% upstream without any additional costs of staff or equipment, and we can do downstream purification for very little increase in cost, and that will spread the overhead costs. So the way we're going to do that, if we're going to do that, is by acquiring something, as we did with BioResearch Products several years ago. Very hard to find small enough company to acquire. And when we do acquire anything, we want to do it with cash rather than with stock. So that's the primary reason for hanging on to cash. Gotcha.
We've talked about this a fair bit in our group about companies of your size. You're publicly listed. You've got plenty of cash for what you need to do. It's almost a shame that you're publicly listed, because you're incurring all these fees as a public company. what, how do you view that as a CEO and a chairman of a company like this? What do you see as the answer to that? Or, have you ever considered going private or anything like that?
Well, absolutely. I mean, several years ago, myself and a couple of the major shareholders looked at taking the company private. And our stock was down on 20 cents and 18 cents and things like that. The difficulty with a company that's had historically some pretty volatile earnings is that it's people are reluctant to take it private. And so eventually we didn't get it done. Not that anybody was really terribly anxious to do it, but you're right. We can save $500,000 a year by being private, and we'd like to do it. So, but that is something that somebody who is looking to acquire a company like ourselves is perfectly well aware of. And we've had several discussions with people over the last couple of years about mergers with them, and they have fallen apart for technical reasons. There's just enough technical synergy to make it worthwhile. But we're always interested. Somebody brings us an interesting company that looks like that they could acquire us or we could acquire them. Either way, we don't care. I mean, I'm a major shareholder and I'm looking for exit value as well as increasing the size of the company. So we'll look at those things.
And Paul, remind us, the insider ownership, what percentage of the business is that roughly?
Well, I own 10%, and so the board owns a small portion, but I'm 10%, and there are another 5 people. So there's one publicly known individual, the Lloyd Miller Trust, that owns 15%. There is one private individual that owns 9%, and there are a number of people who will have 5% of the company.
Gotcha. I've got a couple questions that came in. If you don't mind, I'll ask them. Okay, so we've got a question that says, do you think heparin could be used as a nasal spray to combat COVID-19? If heparin is proven to be effective in combating COVID-19, will IBEX be able to meet the demand?
IBEX, we have a proprietary recombinant expression system, and we can produce tons of this stuff, way more than the market will need. So to answer that question, will heparin ever be used as a nasal spray? I don't know. Yeah, I don't know the answer to that.
Gotcha. Okay, the other question is, you currently have an NCIB in place. During the month of August, IBEX bought 39,000 shares in the 44-cent range. By the end of the NCIB, do you expect IBEX will purchase close to the announced 1.8 million shares? And since IBEX has stopped buying shares, should investors conclude that you're negotiating the purchase of a company?
Well, I wouldn't be able to comment on that.
Yeah, that's what I thought. Yeah. Fair enough. What is your view on NCIBs? I mean, you're a shareholder. Clearly, you guys have instituted it. Do you think it's having the desired effect? Is it? Are you happy with sort of the amount you've bought back so far?
I think it's one of those things you do, like carrying an umbrella, in case it rains. As an academic matter, I mean, I don't think they do a lot for companies, to tell you the truth. But many of our investors kind of like the idea of us doing it, and putting a floor, if you will, under the price of the stock, and which is a thinly traded company, obviously. And so we did it. But do I expect it to be transformational in any way in our market cap? I don't.
Paul, I mean, a lot of microcaps right now are sort of suffering, call it mispricing. There's very little attention in the microcap space right now because of volatility, I guess, in the bigger markets and a whole slew of other things. But what's been the have you generated any attention? I guess you guys have put together what looks like the best year you've had in probably history of the company. Are you getting people interested? Are investors calling? Is there anybody that's sort of paying attention? What can you tell us of sort of the atmosphere out there?
Well, I mean, I certainly got a fair number of calls after we published our third quarter results. And but to be fair, we don't get a lot of calls anyway. It doesn't take a lot of calls to make for a significant increase in the number of discussions we have. But the people who call, I mean, are obviously are primarily private investors. I mean, no fund is really going to take a stake in us for the obvious reasons. It's because unless they're buying it to get into for an exit value that they can see somehow because of the lack of trading. So we have a number of people that have held our stock for a long time, who accumulate, who sell, who buy more. And those are the people that I talk to most often after the quarter results are posted.
Fantastic. Is there anything else you think that we should have asked, or you think that is important that we know?
No, I think you've covered the good questions.
Good. Happy to know I'm doing something right here. Any key takeaway, any key message you want to make sure everybody walks away with today, Paul?
Well, I think this is a solid company. I think it's going to, the volatility is not going to go away in this company because we are very dependent upon large customers who have their own volatility. And the company, I think, can be measured about how it controls its future and staying within its limitations and grinding out increasing cash as we've done, almost every year, including some of the down profit years. So I think we're going to continue doing that, and we'll continue to see growth, but I think we'll see waves of growth.
Yeah, no, that's the way I see it as well. Well, listen, thanks, Paul. It was well over a year since we spoke last, and anybody who purchased shares the last time we spoke, I think is pretty happy, and hopefully that's the case going forward as well. But really appreciate the update. We've been speaking with Chairman and CEO Paul Baehr of IBEX Technologies. Paul, thanks for joining us today, and look forward to catching up with you in the not too distant future.
Yeah, it's my pleasure, Paul. Thanks very much. Okay, bye-bye.
Bye now.